Welcome to Oncology Revolution, where science meets care to transform the cancer journey. We explore evidence-based strategies to enhance quality of life, promote longevity, and empower patients and professionals to thrive beyond cancer.
Hello, everyone, and welcome to the Oncology Revolution podcast. My name is Raquel Maris, and I will be your host today. I'm an occupational therapist as well as a project coordinator at the European School of Lifestyle Oncology. Today's guest is Renee Exelbert, a licensed psychologist and certified personal trainer that brings together clinical expertise, lived experience, and a deep understanding of the mind and body connection. Renee, it is a true pleasure to have you with us today. Thank you so much for joining us.
Thank you for having me.
To begin, I would love to go back to the roots of your work and ask you what drew you into health psychology, and more specifically, what led you into the oncology?
Yeah, it's funny because I ended up with my first job being at a pediatric cancer center, and I often questioned what drew me to that work. When I was growing up, my sister had juvenile diabetes, and so I think that I was always comfortable around illness and caregiving. And so it seemed like a very natural fit to end up in a pediatric cancer center. And I did that work for 6 years. To this day, I regard it as the most beautiful work that I've done in my career. Incredibly rewarding, beautiful relationships that I formed with children and their families. I was helping kids who were going through the cancer journey and working with them and their siblings and their parents. And I did that for 6 years. And after 6 years, I was really exposed to a lot of trauma. I had several relationships that I really put my heart into, and unfortunately, some of those children died, even though pediatric cancer has a really high cure rate of about 80%. And so after about 6 years, I said enough, and it's time for me to leave. And I left in April, and then in July, I was diagnosed with my own cancer, of breast cancer. So that really threw me into the world of cancer in a very different way. And so all the things that I had learned as a psychologist working with kids and their families, I integrated myself into my own treatment. And then I researched all the variables that help people with cancer from a personal perspective, the physical, the emotional. And I found myself on a very mind-body journey where I became a clean eater, a real exercise enthusiast. I became a personal trainer and eventually a bodybuilding competitor. And then I opened up a center where I integrate psychotherapy and exercise.
Oh, thank you so much for sharing that. You have such an inspiring journey and a strong one. And let's dive deep into this part of the psychologies of the psychology in the oncology care. One of the things that often becomes clear very early in cancer care is that the emotional journey is not linear, and it does not end when treatments end. So, from your clinical expertise, what are the most common emotional patterns you observe across the different phases, since diagnosis, treatment, and all the way through survivorship?
Yeah, as I said, I can unfortunately, or fortunately, I'm not really sure, speak about this from both a personal and professional lens. I can tell you that certainly from a personal lens, the diagnosis itself is extraordinarily traumatizing. It really feels like you are in the middle of chaos. And I often talk about this idea of being in a kaleidoscope with all of the contents being shook around, and you're desperately trying to grab a hold of an anchor because your world feels, like completely turned upside down. And at the same time, there's something inside of your body that you have no control over that is growing. And I think that when people hear the word cancer, they immediately think of, am I going to die? What's going to happen with my family? What's going to happen with my physical, my identity, my strength, all those things. And so it's an incredibly terrifying uh, experience at any age. Um, I think that for me, I was only 37 when I was first diagnosed. And so I was a very young mother. I had two young children. My friends were all doing mommy things and on play dates, and I was going through chaos. I think if you are in a relationship, it really challenges so much of the normative, because you are going through this very much together, and it's really traumatizing. Um, so yeah, that's the initial diagnosis. Completely, life throws you a curveball and everything feels unstable. While you're going through treatment, you're kind of trying to get through. Obviously, that is accompanied with a lot of physical and emotional sequela. You're sick. You're trying really hard to grapple with a rapidly changing identity. Many times people don't feel sick when they're diagnosed with cancer. And then all of a sudden, when you're going through treatment, you're sick. And that's, a wild thing, because people will say, well, did you feel sick? And I never felt sick. My personal story was that I was trying to have a third child, and I kind of just did the math, and I thought, well, I'm 37 years old. I'd like to get pregnant, and I've never had a mammogram. I have no family history, but if I'm going to be pregnant for 9 months and then nursing for at least a year, maybe I should think about a mammogram. And it was literally a random thing that I got a baseline mammogram and I had breast cancer. Had I not had that baseline mammogram, I probably wouldn't be here today. Um, so, while you're going through it, a lot of physical and emotional changes. And then after you kind of get through treatment, your visits go down from twice a year to, annually. And at some point, you may start to feel things in the rear view, but there will always be different events that trigger you in terms of a new possible trauma or a reoccurrence, or something as simple as an eye exam. I remember I went to my ophthalmologist and he said, let me look behind your retina, because if you were on tamoxifen, you could have a new cancer hiding behind there. And here I was, like literally just going to an eye doctor appointment. And in that moment, completely traumatized because of my history. So you will often have those things that happen, and your identity is forever changed, because anytime you walk into a doctor's office, you now have a history and you're no longer seen the same way, and you don't see yourself the same way. And it takes a long time to integrate that experience into your identity.
For sure. And you've touched on the concept that I was going to ask you about, the trauma related to the cancer. There's the concept that it has been using more and more in this context. And I wanted to understand your psychological perspective on this. So do you have anything more to add to this trauma experience?
I think the definition of trauma is any physical or emotional experience that overwhelms our ability to cope. Um, and it creates this sense of helplessness or powerlessness, incredible fear. And I certainly think that cancer does that. But it doesn't just do it once, it can do it multiple times in your life, because there, like I said, there will be small things that happen where you no longer are looked at the same way, you're not the same person. You take medication for many years sometimes, which can cause, unfortunately, secondary cancers or different side effects. In my case, I was on tamoxifen. I had a recurrence. I had cancer twice. I'm a high achiever, so once wasn't good enough, apparently. And so, I was on tamoxifen for many years, and tamoxifen, although it was very good to me, it does carry with it also secondary side effects. And so years later, I had, multiple times of terror where they were concerned about cervical cancer, uterine cancer. And so even though you get through this period and you kind of feel like you're okay, there are things that will come up again because you went through cancer. Um, a headache doesn't feel the same. A stomach ache doesn't feel the same. Uh, Not only personally, but from a doctor's standpoint, it's like, well, let's just make sure. And even if you try really hard to live in the space of being strong and healthy, at some point, something's going to happen that's going to really creep its way in and, cause anxiety. And I'm somebody who I strongly believe I live in the space of being healthy and strong. I've dedicated my life to, I exercise every day. I'm a gym rat, you know. So, and I exercise my mind every day. I visualize, I think positive thoughts. I do so much to keep myself mentally strong. And at the same time, cancer does creep back in, into your mind. You just, as much as you try, there are going to be things that happen that scare you.
For sure. There is such an emotional complexity here, and it often goes so many times unseen by everyone that is around you. And something you shared with me earlier that stood out about how enraging it is being told that cancer is a chronic disease. And I would love to explore this with you. How do you now understand the idea of cancer as a chronic experience, psychologically, emotionally, and what does this reframing change in terms of expectations and self-compassion in a long-term well-being?
Yeah. When I was first diagnosed, I was looking for people to talk to. And because I was so young, there were very few. I couldn't find anybody who was my age who was going through this experience until I eventually found a support group of younger women. But at the time, I just wanted to talk to people and know that I'd be okay. And I remember speaking to an older woman, and she said to me, "You just have to think about cancer as a chronic illness." And at the time, when I was 37 and had, hopefully my whole life in front of me, that was a horrible thing to hear because I was thinking, I'm one and done. This is not chronic. This is not going to affect my whole life. This is very early. I've been told how lucky I am. I have to have surgery, take tamoxifen, and I'm good to go. And hearing that enraged me because I was like, who are you to tell me that this is chronic? It's not chronic. And it's funny because years later, after all that I'd been through, some of the things that I heard early on resonate now, because I've had multiple health scares. As I said, I've had cancer, I've had breast cancer twice. I've had skin cancer. Multiple things have happened, and I have been put through the ringer many times. CAT scans, PET scans. We think we see something, and terror. And so I think from that standpoint, cancer is a chronic disease, unfortunately, because as much as we don't want it to be, and as much as psychologically we can decide that, we're done, which I really try hard to do. I think that you have to understand that when you do go through years of treatment, you do, sometimes have issues from those treatments. And somebody once, early on during my original diagnosis, I heard somebody say, once you have cancer, it's always in your body. And these like things, when you're newly diagnosed, these are not the things that you want to hear. And I don't believe that, and it hurts me to hear things like that. I think that, we need to know that we always have to take care of ourselves. And for whatever reason, I got cancer, I'm going to work extra hard than the average person to take care of myself. It's my job to meditate, to be mindful, to eat healthy, to exercise. And I guess I see that as my responsibility because I've had cancer. And so my life trajectory and the way that I take care of myself has changed. And I think that if somebody's ever had an eating disorder or they've ever had early health problems, they too, will see the way that they care for themselves, hopefully differently. And so I do see it as much as I don't like the verbiage, I do see it as a chronic thing. And I don't want to, I struggle with that because I really am such a mind body person. I really take tremendous efforts to stay strong and healthy and not see myself as somebody who lives in that sick world. And I don't. But I do think that as time has progressed, I've made room for the fact that this is a part of my history and I need to really take care of myself and I need to be hyper vigilant and I have to be in extra communication with my body. I if I feel anything different, if I have low energy, I'm the first to be on top of it. And I think that's really important in terms of advocacy, you know. So all of those things. I answered you
Yeah.
in a very very
Mhm.
drawn out way, but yeah.
No, but that's amazing. Yeah. And this idea of the long-term impact and the meaning, it connects beautifully with your TEDx talk, which was amazing. For those who didn't hear, could you briefly walk us through the core message of your talk and what you hope people take from it?
Yeah. So it was entitled The Gift of Cancer, which um, wasn't my title. It sort of just came about that way after, all of the platforms got a hold of it and the core message. And so interestingly enough, online, there were several comments that talked about, how can cancer ever be a gift? And so the initial paragraph itself was sort of a double entendre, right? I referenced the fact that I've heard many people say that cancer is a gift. And as a psychologist, I talked about how gifts like cancer come wrapped in all different packages. And I referenced a lot of terrible things that I've seen as a psychologist through my patients' lives. People losing their child to a heroin overdose or a drunk driving accident or a child's parent being murdered, like horrible things. And what do we do with these gifts, right, that we don't want, that are horrible? What do we do with them? And none of us want them. None of us think cancer is a gift. None of us think any of these things are gifts. They're not. They're terrible. Nobody wants to go through them. And that being said, what do you do when life throws you that? What do you do? And so I went through my talk talking about, can you return it? Can you exchange it? Can you regift it? Can you give it to somebody else? Like, what do you do with these gifts that you don't want? And as in my own life and my own experience, my my journey was about sort of going through this chapter. And for me, it was a long chapter because I had cancer and then 7 years later I had a recurrence. So I felt like I was kind of done, right? And then the chapter kept continuing when we talk about chronic, right? Even though each chapter felt done, right? It wasn't. But it was different. But I talked about, my journey and when I got this gift that I didn't want, it was kind of like referencing again this kaleidoscope of going through this chaos and how you're just, thrown around looking desperately for your stability and what are these things that you grab onto along your journey. And I referenced all of these beautiful things that I learned through my cancer journey, which is like community, support, food, nutrition, exercise, prayer, humor, human touch, meditation, mindfulness, all of these things that really are gifts now in my life. I wouldn't have become a personal trainer. I wouldn't have become a bodybuilding competitor. None of these things would have been in my life. And my relationships probably wouldn't be as rich. And my sense of purpose and meaning probably wouldn't be as profound. But those were the gifts that I got. And I talked about how I, my choice was to kind of not accept the gift and kind of put it on the shelf, right? And come back to it later. But what was happening through all that time when I put it on a shelf was that I was growing and I was changing and my identity was changing and I was making room for all these other teachings in my life that I might not necessarily have had I not gone through cancer. And then we learn all about what we call post-traumatic growth, which is all the ways that you can grow from a trauma, all the gifts that you can take, even though you didn't necessarily want the gift. And so for me, it's that I never wanted cancer. I would never choose cancer. And at the same time, once I've had something bad happen to me, it's my job alone to figure out what I'm going to do with it. And I'm not going to lay down on the floor and crawl up in a little ball in the fetal position. I'm going to do everything I can to empower myself and be strong and healthy and take greater meaning and purpose from this one life that I get to live. And so that's the message. And I think that for me personally, the kaleidoscope method, kaleidoscope symbolism is really powerful. I actually collect kaleidoscopes. I have tons of them all over my office, all over. I literally collect them because I think that it's such a symbolism for trauma and the difficult things that any of us can go through in our lives, that when we're going through difficult things, we're shaken up and our world feels all chaotic and all of our stability is in flux. And then the way the kaleidoscope works is after all the dust settles, you see a new constellation. You see something new and beautiful. And it's not the same, but it's new and beautiful. And so that is the gift.
Thank you so much for this perspective, and I love that image of the sky of the stars. We did have a previous episode where we talked about post-traumatic growth with Adrian. So I do understand where you're coming when you say the gift. Well, the gift. But it is a very provocative title for your TEDx talk. As we record this, this is the beginning of the new year of 2026, and many people are making their reflections, thinking on their intentions and their resolutions and personal change, especially those whose lives have been affected profoundly by a cancer diagnosis. And I would love to bring this topic to our conversation and ask you what are your personal thoughts on New Year's resolutions?
Yeah, well, this Friday is called Quitter's Day because 80% of people who made their resolutions will give them up. I personally used to, when I was younger, sort of be wed to this idea that it's new and it's a great time to make a promise to yourself and, change. And I remember doing that as a little girl. I don't know when that changed. I don't know if it was through cancer or just my own evolution. If I'm going to make a change, I am not waiting until January 1st. Perhaps it's because I see life as like, if you want to do something, you do it now. I personally am always, I'm very goal driven. I am, I do a lot, as I said, of mind body work. I created this technique called visual emotive kinetics, and it's a combination of positive thoughts, visualization, and movement. And so, very much of what I do is focused on integrating the three and combining it into like a goal. So I'm very goal driven. I think about goals all of the time, and I'm always trying to better myself and grow. So I never wait until January 1st. Um, that being said, I think that when you're going through cancer, um, or when you have any kind of health issue, you're derailed and it's hard to accomplish some of the things that you want to accomplish because illness comes and it was completely unexpected most of the time and unwelcome. And all of a sudden, you had these big plans and you have to have surgery or you're knocked out for the next 6 weeks. For me personally, I've had surgery. I can't even tell you how many times I've had surgery. I literally can't even tell you how many times. And I've had to rebuild myself physically and emotionally so many times because it's like for somebody who's a gym rat who goes to the gym all the time, it's like, oh, well, you can't exercise for 6 weeks. And so for me to not exercise for 6 weeks and then go back to the gym and to then try and do a push-up 6 weeks later and see the massive change in my strength is really hard. Um, but I think that people who do make these resolutions or these promises and then they get derailed, or they're going about their lives and they get derailed, I think it's really hard. And I think, as you spoke about compassion, I think it's really important, to take a step back and to use the time to take care of yourself extra, to nurture yourself extra. And back to the whole gift idea. All of this sucks. None of it is good. And at the same time, is there any meaning that you can take from it? Is there anything that you learn from it? And sometimes it just plain sucks. Like sometimes there's absolutely nothing that, remotely feels meaningful. But you always learn something. You always learn like who's around, who listens to you, how you respond, how you learn a lot about yourself and your resiliency and your support network and how you cope and how you can rely on yourself. And unfortunately, the more you go through these things, the more you're tested and the more you kind of have to look at your own history and say, I've gotten through this before and I'll get through it again. And I know I was planning to do this, but I can't do it now. I have to put that on the back burner. And that's happened to me as well, where I've had goals or I've had things that I wanted to accomplish or things that are on my schedule. And I had to pass or I couldn't do it then. And just the way it is.
Yeah, and that actually happens all the time, right? Because, as you said, it's Critters Day on Friday,
Yeah.
the 8th, right? But are there any practical strategies that we can recommend to maintain motivations, either motivation for the resolutions of the new year or along the year when you set a goal and you're trying to achieve that goal, but at some point you just can't or you just don't feel like you are able
Yeah.
to do so? What can we do?
So, definitely, I think the number one thing about making goals is that it comes back to your personal why, because I think that many people feel pressured in our society and with social media to perform, to high achieve, and a lot of the times their goals or their resolutions are about, you know, keeping up. And so I think it's really, really important to make sure that your goal or resolution comes back to your personal why, number one. Number two, we want to always break down our goals into what we call SMART goals. We want to keep them very specific, measurable, achievable. And studies show when we say achievable, it should be something hard that feels right outside of our zone, but we can still achieve it. Has to be relatable, meaning comes back to our why. Why are we doing it? And time bound. So it can't be this grandiose goal that says, I want to get healthier. What does healthier mean? That is so broad. Is it emotionally healthier, physically healthier? Do you want to lose 5 pounds? Do you want to quit smoking? So it has to be very, very specific. I want to lose 5 pounds by April. Why is it relevant? How am I going to achieve it? Is it achievable? What is the specific way I'm going to do it? I'm going to exercise every Monday for, whatever. I'm going to exercise every day of the week for 30 minutes. And I want to do it by April. It has to be very, very specific. If we write our goal down, we're 42% more likely to achieve it just by simply writing it down. If we're accountable to somebody else, like maybe a partner, who we can report back to sometimes our progress. That also makes us more likely to carry out the goal. But I think that a big thing is also having compassion that if you don't achieve your goal, it's not all or nothing, that our brain isn't wired for these large massive changes. Our brain is wired with neuroplasticity. We have to do things over and over and over again for our brain to learn. And so it's small habits. And so if you have a goal start off small. Start off with like a sustainable thing. If you want to be healthier, instead of having a greasy pork sandwich, add some lettuce to it. No joke, start very, very small. Or if you want to exercise and you can't make it to the gym, do walking lunges between your bedroom and your, dining room. Or when you're watching TV, get up and do jumping jacks during commercials. Very small changes so that it eventually becomes a part of our identity. And I also like this idea of anthem words for the year. Instead of making promises that are so all or nothing, I either do this or I don't. Anthem words are like choosing a word for the year, like focus or intentional or meaningful or mindful. And so that way, when you're going about your everyday, you can just kind of have that word in your brain and come back to, well, I'm scrolling a lot on Instagram. Is that in line with my word for the year, which might be focus, right? And so it just kind of keeps you in check in a gentle way that's not punishing. It's more just kind of moving in the direction of where you want to go.
Yeah, that's an amazing strategy and a new one for me. I haven't heard that before. So thank you for sharing. Let's dive into a different topic and another theme that has been very spoken about recently is the growing role of the artificial intelligence in healthcare. This is a topic that generates both excitement, maybe some fear. So, from your perspective, is AI in healthcare something to fear or something to embrace? And taking on one step further, how do you see AI functioning as a companion in psychological and oncological care?
Yeah, I think it's both. I think it's something that can tremendously help us, and we have to be really mindful of the concerns at the same time. As a psychologist, I'm always concerned about AI chat bots that are advising people on ways that they could, commit suicide or die by suicide. Like that, those are actual cases, and those are really frightening things. Um, I think that algorithms, can really target very vulnerable people. So from a psychological perspective, I think that there are a lot of concerns, and there can also be a lot of positives. From an oncological perspective, I think that it can be tremendously helpful in terms of um, genetics, um, tracking people who have specific family histories, specific genetics, and um, figuring out, things way ahead of time that they could be doing to help their you know, uh, possible illness, tests that they could be doing early on. I think that's really important. And at the same time, could also cause more trauma for people, right? Because even if you know something genetic, it's great to go through things that can sort of offset or result in earlier detection, but at the same time, it could be traumatizing. Um, so I think those are important things. I think that finding people in different countries all around the world, and understanding specific treatments that can help other people all around the world is fascinating. Um, I think that being able to come up with specific treatment plans based on what's available in clinical trials is there's so many amazing things, targeting treatments, early detection, so many amazing things, and at the same time uh, there could be privacy ruptures. Those privacy ruptures could also have somebody be seen very differently. Like I said, I've had the experience of going into doctors' offices and being treated differently. Algorithms can sometimes result in discrepancies or inequalities in populations. Algorithms don't always represent all people equally. I think the human touch is so critical, particularly with any kind of illness, emotional or physical. The human interaction is critical. I know from myself, I don't regard myself as the average breast cancer patient, whatever that is. There is no average, but I don't regard myself as the same as somebody who's going through the same illness as me. You know, I go above and beyond to take care of myself and exercise and eat clean and body build and all these and mindfulness and all these things. So I don't think that we're all the same. So I think that there are some real positives and some things that we have to be really careful about.
For sure. And I completely agree. And with the rapid growth of technology and AI, the access to information, it's uncontrollably. But not always it is clear. So it is extremely easy to encounter misleading, conflicting, and oversimplified health information. So I think it also is our role to put some scientific scientific position on this. And I wanted to ask you, what do you think about the role of clinicians and educators in translating evidence into actionable, realistic guidance for the
What do you mean by that?
so, what do you think could be our role as clinicians when we are trying to translate the information to the patients? How
Um,
can we give them the information that is not overwhelming and that can explain what the misleading information that they have just read on ChatGPT?
Yeah. It's interesting that you asked that question because the first thing that it makes me think of is the patient portal when somebody is entitled to get their medical results immediately and how they read this very frightening sometimes frightening, medical jargon that they have absolutely no idea what they're reading. And there's no one available to go over the results with them, right? And so I've seen people take these test results and put them through ChatGPT. We all know people who have symptoms and they go down the rabbit hole and they're Googling and they're on WebMD and all these things, which I personally think is really, really, really dangerous. So I think that some of this comes down to drastic changes in the healthcare system, which is a whole other segment. But, I think that there should be guidelines in terms of how long it is until patients wait to get their results. I think that there should be specific people designated if your doctor's unavailable to like very specifically go over your results. For me, one of the most heartbreaking, traumatizing experiences that I've had is waiting days for medical results. Possibly now with the advent of these of patient portals being available, medical results being available immediately, having a medical result, not knowing what it means, being terrified, leaving message after message. So I think that there need to be drastic changes because information is so readily available now. And I think that patients are unfortunately looking things up and aren't getting proper answers. And so I think that there need to be real changes in terms of um, you know, uh, healthcare, employee patient relationships, timeframes, um, and that's a whole different discussion because it's so vast. It's so vast, and I think that AI complicates it so much more.
Yeah, for sure. And as we begin to wrap up, I would love to give you the final word and ask you what is one message you would love to leave to our audience today?
I think that we all go through different things in our lives, and one of the things I mentioned in my TEDx talk was that as a psychologist, I often had parents say to me that they wish their kids didn't have to go through their divorce, or they wish that their child didn't have to see their father, an addict. And I feel like whatever household you grow up in, you're going to be subject to something that happens, whether it's health or finances or divorce or addiction or whatever. And I think that we we will all at some point be patients. Um, we all at some point will know somebody impacted by cancer. And I think that, we have to take the experiences that happen to us in our lives, whatever they may be, and figure out how we're going to grow from them. Like we've discussed earlier, right? Like nobody wants bad things to happen. None of us want these things, but once they happen to us, it's like a whole chapter, right? Or a whole story about how are we going to take this adversarial experience and grow from it, make it the best that we can. And so much of my life has now been shaped by the experiences that I've had. My world has dramatically changed since I've had cancer. And much of who I am today, I wouldn't be if I didn't have cancer. And once again, I wish I didn't have it, but the fact that I did, I have, grown tremendously. And I'm going to take everything that I've experienced and try to put out into the world things that I've gone through that can potentially help other people. And so everything that we go through, all of us, is potentially a gift to someone else. Every negative thing that we experience, there's somebody in the world who needs to hear our exact story. There's somebody in the world who can learn and grow from us. And so we always have something to offer.
Well, thank you so much. And especially ending on this note about the community support that is so important. Renee, thank you. Thank you so much for
Thank you.
being here, for accepting our invitation. It was an honor having this thoughtful conversation with you, and I truly hope you have a wonderful year ahead.
Thank you. You too. Thank you so much.
And to everyone that is listening, thank you also for being with us and wishing you all a happy new year. And if you think that this conversation is helpful for somebody else, please share it.